Critical Incident Analysis, a Reflective Teaching Strategy by Lindsay Snodgrass. This presentation will briefly describe critical incident analysis as a teaching strategy that can be used with both students and professionals in the workplace. This presentation will explain the purpose of critical incident analysis, the advantages and disadvantages associated with this teaching strategy, and discuss how this teaching strategy can successfully be applied. This presentation is geared towards nurses working on a neuro-med-surg unit, which has recently been experiencing a lot of patient falls. By the end of this presentation, participants will be able to describe the critical incident that occurred in the video. They will be able to identify one cause or circumstance that contributed to the critical incident, and then they will be able to verbalize which interventions or protocols could be implemented in order to prevent incident recurrence. In critical incident analysis, students are asked to describe and analyze a particularly meaningful incident that they have experienced or observed in the clinical setting in order to connect classroom content and curriculum objectives to actual clinical situations. For this strategy, instructors are required to communicate clear objectives, use direct questions to stimulate critical thinking, and require students to reflect on personal experiences. Additionally, it is imperative that instructors provide thoughtful feedback. This strategy is student-centered, useful in all levels of learning. It promotes critical thinking and generates connections between theory and clinical practice. It encourages discussion, and most of all, closes the feedback loop between teacher and student. The disadvantages of this strategy is that it's time-intensive for both students and instructors. Student-directed learning can be challenging for instructors who like to play the role of the expert. And also, students may not know how to use reflection as a learning technique, and so it must first be taught to them. Whether used through reflective journaling or an individual performance review, the participant needs to be asked what has actually occurred, what causes and circumstances contributed to allow the incident to occur, and what measures can be taken to prevent recurrence. The critical incident that you are about to see is a reenactment of a patient fall on the neuro-med-surg unit.
Hey, how are you doing?
Okay.
Do you need anything?
I mean, yeah.
Hang on a second. This is Anna. Okay, I'll be right back.
Come in here. Help.
Oh my gosh.
For this scenario, the nurse manager will use this critical incident analysis teaching strategy to perform one-on-one teaching with a nursing professional to review and counsel professional performance. This reflective analysis will follow Gibbs' reflective cycle, beginning with a description of the critical incident, uncovering feelings and thoughts, evaluating the circumstance, analyzing the situation, concluding what else could be done, and initiating an action plan.
Anna, I wanted to sit down with you and talk about your patient fall from the other day. Can you tell me a little bit about the circumstances that were going on before your patient fell?
Well, the patient was confused. She kept trying to get out of bed. I've had her for 3 days. She won't stay in bed. She won't wait for me to come in there when she needs to get up. She just is very impulsive and always is trying to get out of bed. And I had 5 other patients that needed me, and I was just really busy.
So I hear you saying that you were really busy, and I know it's frustrating when you have patients that don't really follow your instructions and are trying to get out of bed. That can keep you even busier. Any other factors going on that were outside of your control?
Well, I was in there talking to her, and the doctor called me and told me that he needed me to give a medication stat to another patient. And I had 2 other patients that needed medications and another patient that was about to go for a procedure. And I just had 10 other things that I needed to do. So I couldn't stay in the room the whole day.
Do you feel like maybe there's something that you missed that you could have done to help keep your patient safe?
Well, I guess I could have had the bed alarm on and made sure her call light was in range, so if she needed something, maybe she would have called. And the floor was kind of busy, or kind of dirty, so she probably could have slipped on that too.
Tell me a little bit more about our policy for keeping the patient safe and helping to prevent falls. What else can you tell me that maybe you didn't do?
I know we have several interventions. Like I said, the call alarm, or the bed alarm, and the call light, as well as making sure the patient has on a fall risk bracelet to alert staff to pay close attention. And I know she should have had on no-slip footwear if she was going to be getting up. And just making sure that the surrounding area is clean and no fall hazards around her.
Do you think that maybe your patient would not have fallen if you had done a little bit more of those interventions?
Probably not. I know that the call alarm, the bed alarm probably would have alerted someone close by to go in the room and check on her before she actually fell. That might have helped.
Now, how was your patient after she fell? Was she injured?
No, thankfully she was not injured. She was definitely shaken up and scared, and I don't think it helped with her confusion, but she's safe right now.
What did you do after the fall?
I had to notify the doctor and let them know the patient fall and to come assess for any injuries and notify the charge nurse as well. And also fill out a post-fall analysis packet and implement some of the interventions that are in the Baylor policy.
Well, I'm really glad that your patient wasn't hurt, and I'm glad that we can talk about this. What can you do differently next time to maybe prevent the falling from happening again?
I think make sure, just slow down and to implement some of those interventions beforehand and not wait until there's actually a fall to start doing those things and continually round with the patients and that type of thing to keep a close eye on them.
Well, it sounds like that's a really good action plan, and let's move forward with that. Thank you.
This reflective teaching strategy has helped our nurse learn from her experience, raise self-awareness, and improve her practice. Now let's watch as our nurse uses the analysis to change her professional practice, keeping the patient safe and preventing fall recurrence.
Are you okay?
Yes. Do you adjust my pillows?
Sure, of course. How's that?
Better.
Okay, well I'll come back and check on you a little bit later, okay?
Okay.
Oh, let's double check. Your armband's on.
Is something?
Yeah, it's just a fall risk bracelet. Make sure you don't fall. Just alerts us to make sure that we keep a close eye on you.
Oh,
We'll put your head in the lowest position.
okay.
And I'm going to turn the bed alarm on just for your safety, just as a reminder to try and not get up without our help, okay? Here's your call light. If you need anything, you just press the button.
Okay.
Okay, don't get up without us, all right?
Okay.
Sure. Okay, I'll be back.
All right. Can you send Anna in here? Oh,
Do you need something?
I just wanted to say thank you.
Oh, you're welcome.
So sweet.